This is Dr. Hansen with the 60-second synopsis of this video. More detail after if you would like to listen. This is how to treat upper respiratory viruses where you get the runny nose, itchy, scratchy throat, congestion, a lot of sneezing, etc. You have to stock your house with gargle that contains thymol, such as Listerine. You also have to stock your house with certain types of type nasal sprays, either something with xylitol, such as Xlear, or you can use azolastine, or you can also use dilute povidone iodine. Anyway, you'll have the nasal spray and the gargle around. As soon as you feel the onset of any symptoms, runny nose, itchy, scratchy throat, you start using the nasal sprays, sniffing those 4 times a day, and you use the gargle, 30-second gargles, 4 times a day for at least 5 days to get the virus load down out of your nose and your throat. And that's how you prevent viruses turning into anything big or from their just dragging on or maybe aborting the whole thing to start with. Of course, this is not specific medical advice for any particular individual. You should consult your physician. However, this is something I do and my family does, and I advise many of my patients to do. Now, for further background, when you catch a cold virus, that can mean many different types of viruses. That could mean the typical viruses would be adenovirus, rhinovirus, coronavirus, respiratory syncytial virus, parainfluenza virus, and influenza virus. Those are the most common, probably half dozen viruses that cause upper respiratory infections. When you inhale these particular viruses or catch them however you catch them, they populate the various parts of the anatomy. And here you can see they populate this. This is a cross-section of the nasal and sinus area. You can see they populate this nasal cavity portion right here, and which is the section kind of behind your nose. And then they also populate a little down here behind your tongue, if you will. That's the oropharynx that you'll get viruses and sometimes bacteria back in this area. Those are the places where these viruses locate. So you want to knock their colony count down. Not going to eliminate them to 0, but you want to get them way, way, way down. And that's what this does. The sprays and the gargles I talked about at first do that. And a little bit more about that. The earlier the better. So the quicker you catch this. You want to catch this before the viruses turns into the billions and etc. So you want to get this early, the first 24 hours, maybe 48 of an influenza or upper respiratory viral-like illness. Practicality behind this is that you want to actually knock down the viral load as they continue to multiply so that the viral load is down low enough that your body's own immune system can handle these particles, that the washing of the viruses out and the chemicals used in these non-prescription items can actually denature a lot of these viruses so your body can handle what's left over. Now let's get into the specific things that we're using, the specific chemicals. The gargle, very important. You want to use a gargle mouthwash that has thymol in it. And those are principally most of the Listerine products do. There's a few other products that will tell you that they have added thymol, but THYMOL, get it with that. And you want to gargle at least 30 seconds and do it 4 times a day. You do not want to swallow the mouthwash. This is a gargle and spit. That's very important to get the oropharynx clear of viruses. Now, to get the nasal cavities clear, there's a few different things you can do. You can use any spray that contains xylitol, Xylitol in it. The most common one that you can find at the drugstore would be Xlear, Xlear, but there's also other agents out there that advertise on it that they have xylitol. So you can get many brand or generic products as long as it has xylitol in it, which is a 5-carbon sugar, which is also good for dental health with chewing gum and etc. But that's another story. The second type of spray you want to look at is something called azolastine. It used to be, it's still a prescription also, it originally came out as Astelin. It is an antihistamine. That's been found to be effective with using nasal sprays to help depopulate the nasal count. And again, that's Astelin. The third thing that you could use would be dilute povidone iodine, otherwise known as betadine. You can make your own betadine by 10% bottle and dilute it down with distilled water to less than 1%, down to maybe 0.6%. Or you can go ahead and get pre-made online or at certain drugstores where you can get povidone iodine at 0.6% or maybe 1%. You don't want things stronger than 1%. That'll burn your nose like crazy. It won't hurt you, but it'll burn your nose. So those are things. Then you also can just use, if you don't have any of those things, if let's say you do a lot of nasal lavaging, that you're washing out with these lavage machines, the snot out of your nose at night, you can add a little tincture of these other agents into your sinus wash and use that also 4 times a day. So you're just getting those viruses out of there. So as with any cough cold prevention, your toolkit is going to also want to have zinc, 25 milligrams, vitamin C, 1,000 milligrams. Ask your personal physician whether you can take those things, but in general, they're fairly easy to take. So good sleep, good hygiene, those are all part of your toolkit, as well as the parts of your toolkit, which include the mouthwash with thymol and also either the xylitol spray, the azolastine spray, and or the dilute povidone iodine spray. Keeping that around and also having a travel pack with you. You never know when you go out of town that you might run into an itchy, scratchy throat, and you want to get it if you can within the first 24 hours. Sooner the better. Okay, thank you very much for listening. I would also just remind you that this is not medical advice for people in general. Do what your doctor says. This is what I do, what my family does, and other friends do, and other patients do, and it works very well for us. So thank you for listening. Thank you. Bye.